Hello, welcome to the Mom Series, The Misunderstanding of Multiplicity. Happy New Year, happy 2015. I wanted to say quickly that I made a mistake on the video that I did, the previous video on Creature of Habit, A Journey. I wanted to correct how I pronounced a person's name. So, Creature of Habit, A Journey is going to be released on February 22nd, and it was self-published by Kari Innings Ainsworth, and I've been pronouncing her name Carrie, and it's Kari. Kari Ainsworth is Trudy Chase and the Troops' daughter, and Trudy Chase and the Troops wrote the book Creature of Habit, A Journey. And I also wanted to say Kari is looking for people to do write-ups and to be involved in the launch. So Trauma and Dissociation DID project, I haven't been very involved with y'all, and the reason being is I don't like to get too involved in societies or groups that specialize in one thing and one thing only, because I'm trying very hard to broaden my vision and not be narrow-minded. So for my own personal goals, I'm trying very hard to keep a broader view of things than narrowing it to specialized groups. But I am in support of what you're doing, and I think this book would be great for any of the people that hang with y'all there. And same thing with ivorygarden.org. I support what you do, but I don't hang with any one group, because I think it can get very narrow. We can read things into things that aren't always there sometimes. So I just like to keep it very broad. Australian Net Plural, I think you know how I feel about things, and Kari would be grateful for any launching articles or events that could go on, so just putting it out there. Okay, so I wanted to talk about, I am notorious for mispronouncing things, and I, as most of you know that have watched my videos over the years, I haven't been doing any videos this past year because I really slacked off on making videos. Once a whole bunch of people started coming out here to vlog, I felt like, everybody's doing their thing, and I need to do my thing, and that's get away from the YouTube so much. And I took down a lot of my videos, but a lot of them will be coming back up again. And I tend to just not want to be redundant about things now. So if I catch something in the media that has to do with multiple personality or dissociative identity disorder that I really want to talk about, then I'll come out and make a video. And I saw something the other day. It was on Dr. Phil. It wasn't the other day. It was like October, November that I saw it. And I tried to make a video about 4 or 5 different times, and it just wouldn't upload. And I've been making this video since 10 o'clock this morning at 6 o'clock at night. So I've been mispronouncing things. So I'm just going to go with it. So here goes. Dr. Phil did a show called I'm Afraid My Mom Might Kill My Children. She claims to have multiple personality. This was October 3rd. It aired. The show, I'm going to leave a link up so you can go watch it. Judy is the woman in question that has multiple personality. Her grown daughters did not believe that she had multiple personality. They believed she was faking it. They had grown up knowing that she was an alcoholic, she was a drug user, and that she was irresponsible and she was moody. And that when she did irresponsible behavior, she recently began blaming it on multiple personality. And this just came out of nowhere to them. Well, in the course of the show, Dr. Phil unveils that the husband always knew that his wife was multiple. She was diagnosed when the girls were young. Back in the 80s, she was diagnosed multiple personality. And she was diagnosed by several doctors, multiple personality and DID. And I guess she had diagnosis papers that she burned. And all her daughters knew was mom would go into the hospital for drinking, have a nervous breakdown, drugs, fall apart, go into a locked ward, come out and drink and drug again. So nothing ever changed. They gave her an ultimatum and said, we don't want to have anything to do with you, and we're not going to let our kids be around you. She had been babysitting their kids. And, she had been grandma. She had been babysitting. And I guess I kind of thought the same thing Dr. Phil mentioned, which was, this has nothing to do with multiple personality. Never mind the multiple personality. If my mom is drinking and she gets up and just leaves and goes and does drugs or takes off or whatever and has no memory of it and is blacking out in alcohol blackouts, why would you leave your kids with her? Never mind whatever she's blaming it on. Why would you leave your kids with her? And actually, the oldest daughter was saying that doesn't matter. My mother's engaging in alcoholic behavior. I don't want my kids around that. Okay. Dr. Phil met another alter, I guess, two of the alters, persons, personas, I call people, that Judy was with are integrated parts of others, is the way she explained it, is that she had a larger group that integrated down to two. So Carrie, a younger girl, was made up of all the teens in the group. And Emmeline was made up of all the anger in the group. And Emmeline was really getting blamed for everything. Emmeline was the one who drank too much. Emmeline was the one who cheated on the husband. Emmeline was the one that ran away and did crack cocaine. Emmeline was the one that swore at the daughters and threatened them. Emmeline. And at one point, Dr. Phil was like, what does she need you for? And Judy was just the victim of the altered personality. She was like, I'm just the victim here. I don't know anything. I just crying, her daughters wouldn't be with her grandchildren she couldn't see. The family was all split up, and she just felt so hopeless, and she was just a victim of multiple personality. Okay. Dr. Phil was just kind of, it doesn't really matter if you have multiple personality. Although, because the multiple personality becomes a scapegoat. But he said, look, I don't know if you have multiple personality. I don't know. He said, I've never seen it. I've never seen it in all my practice. So I'm going to send you to see Dr. Sophie, who was I guess is a experted doctor in New York City, for a session. Sit down, talk to him, see what he thinks. Well, you know what? Dr. Sophie couldn't say if she was multiple either. Dr. Phil couldn't say. What they could say is that they did do a lot of background digging, and they found out that Judy was diagnosed by experts back in the day, in the 80s and the 90s, and told, this is what you have, because she met the criterion. She had an abusive childhood background, trauma, lots of trauma. She went through a lot of heavy stuff, and she presented with the kind of symptoms, and then the doctors observed the behavior that would be such that would be considered multiple personality or DID, because that's what they were taught it was. And Dr. Phil really explained this by explaining what iatrogenic is, an iatrogenic illness. And I think this goes to the weight of talking about the semantics wars that people always get into with the controversy about multiplicity out here, where a lot of people say, oh, doctors create false memory, repressed memory, doctors create alters, doctors create multiple personality or dissociative identity disorder. Well, I've never believed they create it. I don't believe that doctors maliciously go in and say, okay, I'm going to go create false personalities in my patient because I want my patient to do what I want my patient to do. I've never believed that. Although I'm sure it probably happens with a few, undesirable doctors out there. But I think the majority of doctors in the 80s and 90s were taught by specialty doctors, this is what multiple personality is. If a patient comes to you with this criterion, with this history, with this presentation, and you observe this, then it is that. And then, of course, the doctor is doing their job by explaining to the patient what the course of the treatment, the therapy, and the illness, and what to expect, and explaining the process. And it would be just the same if you went to an oncologist and you had cancer, and that oncologist knew what generally would be expected. They would explain it to you. I used to want to know what doctors thought about the course of an illness, and now I don't, and I've stopped a long time ago. And I think iatrogenic, the side effect, the natural iatrogenic side effect of a treatment of any illness is scary to me. So it really explained to me this whole controversy that I think we've had trouble finding the right words to express when I say it's not that I don't believe in multiplicity, I don't believe in the way it's being told that people have it. And what Dr. Phil came back with is he did not believe that Judy was multiple, but he did believe that she was suffering. He said to the daughters, your mother is not making this up. She is not malingering. She is not faking. She is not gaining anything from this. In fact, she is suffering. Your mother is suffering. And he explained that she is operating within the frame reference and symbolism that she was taught by doctors who were taught that this is why she was behaving that way. And that she did make some gains from operating that way. She was able to handle some things better and other things not. So I just thought it was very, very interesting to look at the aspect of iatrogenics in any illness. If we go to have a surgical procedure, the doctor might tell us there's going to be a lot of swelling and a lot of bruising and you can have a scar. Or a doctor might say there might be a little bruising. You might have some swelling, but there will be a scar. But it'll probably fade. And I mean, you're going to see your illness in the context of what your doctor prepares you for. And there will be a scar. That's just a natural, iatrogenic, natural result of an operation, a scar. So I just thought it was very interesting, and I thought it was worth mentioning to always consider the iatrogenics in the aspect of any illness. And I wanted to say, I'll leave a link for you. It's called Dr. Phil, I Am Afraid My Mom's Going to Kill My Children. It was very sensationalized, but I thought it was very well done show in that they did bring up the aspect of iatrogenics. Okay, thank you. Take care. Have a great day. Bye.